Hello there, Dr. John Norton Jr. and with a little bit of information on medical containment. Part two of my series on medical containment. In part one, I discussed what is mass containment systems for in public health. Part two, I'm going to dive in a little bit into what more of a mass triage type of situation. Let me explain a little bit. When you're doing mass containment with a disease that is either newly discovered or with existing diseases that are already there are very bad diseases. You want to definitely shield the public from those kind of diseases, and this is an isolation ward is what would be used. Medical isolation is nothing new. Medical isolation ward is nothing new for usage in public containment, but it is not as well known about by general public about it. So let me explain a little bit. If you had a disease that you came from Africa or a foreign country, and it's a new type of disease that's never been discovered, or it's an existing disease such as Ebola, that is a mass killing type of disease, you would want to do medical containment with that. That is simply put the patient into a separate ward in a hospital or a separate wing or separate place where the patient is directly treated by medical staff and by medical physicians. More than one medical physician being also with a specialist, several or one or more physician specialists that would be treating the patient. And It is a high containment system where only those who are allowed to go in are certified to do it, and also where you're wearing maximum containment gear on your body, and also a ventilation system and respiration system as part of your suit. To work on the patient means that you have to maintain a certain level of standard to not infect yourself and not infect others that are in contact with the patient. So this is a form of medical containment, which is standardly used for patients that are highly infectious and also that have rare diseases that come from Africa and Asia and other parts of this planet. There are either known diseases that are mass killing diseases, such as smallpox and bubonic plague, but also diseases that are more well known. Um, so this is an example of another example of medical containment. Thank you very much.